Here we are at the end of this mini-series from the Sports Acupuncture Alliance. I've got one more interview for you, this one with Matt Callison. I think you're going to enjoy it. Again, much appreciation to the Sports Acupuncture Alliance and to LASA OMS for their support in creating this opportunity to bring you this unique series. Let's jump in now and have a discussion with Matt. These conversations come to you through the generous support of our sponsors and members. All the sponsors here provide helpful products or services that you'll find beneficial in your clinical work. Want to get better at treating concussions and other neurological conditions? Clayton Shoe has some innovative methods. Blue Poppy, your new one-stop shop, has speedy shipping options on everything that you need for your clinic. Later in the show, Jane offers you helpful suggestions on how to raise your rates, and Golden Flower Chinese Herbs shares a journey of healing that I think you'll recognize. Do be sure to visit the sponsors page on the Qiological website to take advantage of all the special offers our terrific sponsors have for listeners of the podcast. Picture this. Your clinic is buzzing with patients, and then you realize that you're down to your last box of needles. No need for panic, because Blue Poppy, your one-stop shop for all your acupuncture needs, they ship orders received before 3 p.m. on the same day. With a quick visit to Blue Poppy's website, you can order premium needles, herbal formulas, and that special Dr. Bob's oil that your patients love. Blue Poppy understands practitioners can't keep patients waiting. That's why they strive to get you what you need when you need it. From high-quality Chinese herbs and formulations to acupuncture supplies and clinical essentials, Blue Poppy has served practitioners for nearly 40 years with products that meet the highest of standards. Discover everything Blue Poppy has to offer by visiting www.bluepoppy.com, and don't forget to subscribe to their mailing list for exclusive offers and more. Ever found yourself listening to a Qiological conversation and thinking, wow, I needed to hear that? Yeah, me too. And I never know when I'm going to hear a guest say something that stops my world and reboots it with a larger perspective. If these conversations have ever helped you to feel more grounded, more inspired, or just less alone in this strange and wonderful work we do, consider becoming a member or supporting the podcast with a bit of tithing to the donation jar. It helps keep the lights on here at the Qiological Sound and Motion Lab so that we can bring you these conversations every Tuesday morning. You'll find all the details at qiological.com. Thanks for listening and for being a part of this.
Hey there, I'm Cameron Jafari, an acupuncturist from Los Angeles. So I started learning nanopuncture from Dr. Clayton Shoe because I was facing these complex neurological conditions like stroke and MS in my clinic, and I just felt like I lacked a solid process to treat them. Brain-related issues always felt like a whole different animal, and I was looking for a clinical system that worked and could guide me through them. So after attending my first nanopuncture seminar, I was able to apply the process pretty quickly and with pretty amazing results. I remember the first stroke patient I saw afterwards was a guy who had had a stroke 2 years back, and he couldn't talk at all. And after a few treatments, he started saying a few words. And a few treatments after that, he could actually have conversations. It was pretty incredible. So this is why I feel like nanopuncture is the future of acupuncture neurology. And you can be a part of that. Their next seminar is on treating concussions and is being co-taught by both Dr. Shu and Dr. Ayla Wolf in New York City on April 26th and 27th. To learn more, visit nanopunctureseminars.com.
You guys have probably heard of Matt Callison, so I'm not going to go into too many details about this cat. Matt, welcome to Qiological.
Hello, Michael. Thank you for having me.
It's great to be here with you.
I appreciate it.
Hey, I'm a little curious. What got you started on all this stuff anyway?
This stuff being what?
This stuff being, well, acupuncture, first of all. What drew you to acupuncture? And secondly, what drew you to the sports acupuncture?
Well, I started off as an athletic trainer from San Diego State University, getting my undergraduate degree in physical education and emphasis in sports medicine, and studying toward athletic training. And then I was a little disenchanted where I was going with my education. And even though I loved the rehabilitation aspect of it, every single part of diagnosing musculoskeletal injury and the mechanics of musculoskeletal injury, where I was going actually as an athletic trainer in the job form was not very attractive. So I sold everything that I had except for my surfboard and a backpack, and I went to Australia.
That sounds like a good idea.
It was great. It was great. There was nothing holding me back. And so still involved in sports medicine and still intrigued about how sports medicine works. Loving surfing and loving baseball, and just kind of a sports jock myself. I wanted to end up staying in Australia because I loved it there, and met a man in Perth, Western Australia, that was a physio. They don't have athletic trainers down there. That was a physio that was practicing this voodoo called acupuncture. Now, this was in 1992 when this occurred. And so, actually, no, we have to take that back to probably 1990. Yeah, so he planted the seed for me. I watched how he was able to get people out of pain, how he was able to put needles into people and change range of motion and change different aspects of that musculoskeletal injury. So he's the one that really planted that seed for me. So then on my way back to San Diego, my hometown, I ended up visiting a friend, and was only going to stay for 4 days, but ended up teaching at the massage school there and stayed in Maui for about a year and a half. And so I taught and learned massage, and always was thinking about the acupuncture, and I checked out the acupuncture school in Maui, but it just didn't quite seem like it was at the level that I wanted to go. So it was great learning massage and learning how to be able to do structural integration and myofascial release techniques. But I still always wondered about what is this thing about putting needles in people and manipulating and changing the way people move. That was always intriguing for me. So I ended up going to school at Pacific College of Oriental Medicine. That's when it was one campus in San Diego, only 4 rooms. So it was a while ago.
That was a while ago, yeah.
Yeah. And actually, when I graduated from school, I didn't call on a cell phone because they weren't out yet. It was actually on a rotary phone. Yes.
You're dating yourself
It
here.
gives you an eye, and that's okay. That's all right. This life's been good. So because of my background in sports medicine, and then it was a natural bridge to be able to apply traditional Chinese medicine with sports medicine. And that's something that I've been doing for the last 30 years, really.
Yeah. So it sounds like you had this deep background, really understanding physiology, really understanding anatomy, how the body's put together, how it moves, how it connects, and how all that works with sports performance. Then you had a bit of a walkabout, ran into acupuncture, and then you put these two together. I'm a little curious, and I suspect a lot of the listeners are a bit curious as well, about how I'm just going to use air quotes here, sports acupuncture, how that is or is different than the kind of stuff that people learn in acupuncture school.
Okay. So if I'm understanding your question correctly, let's see if I can repeat this back, is sports acupuncture taught in acupuncture schools?
Ooh, I hadn't thought to ask the question that way, but yeah, let's go with that one. I like it.
Most schools do not teach sports acupuncture because there's a certain curriculum that they need to be able to have taught in order for those students to be able to pass the state board examination.
Right. There's an exam that there's a gate we have to walk through called the national exam.
Absolutely. So some schools, though, are emphasizing musculoskeletal type of orthopedic acupuncture. I created a class for Pacific College of Oriental Medicine 16 years ago, and it's called Treatment of Orthopedic Disorders. And it's currently being taught at all 3 campuses, and other acupuncture schools are picking that up as well. So it's based on my work that I've put together over the last 30 years or so. And so that is a required class, which is great, but not all schools are going to have that. But that does bring me to a point, if you don't mind me going off on a little bit of a tangent, because orthopedic acupuncture and musculoskeletal type of acupuncture, where it's going in the U.S. right now, it's a little scary to me. Students are finding that just by putting acupuncture needles into muscles, at certain areas, certain offshore points, it will make a dramatic effect in range of motion and manual muscle testing. But the traditional Chinese medicine student, and probably the supervisors and some of the teachers as well, are not emphasizing that every single musculoskeletal injury, every single orthopedic injury is going to have a Zong Fu component. It's going to have a direct Zong Fu component that either created the injury, or let's say there's a professional athlete and their Zong Fu signs and symptoms is pretty nil. You can still enhance how this person is going to rehab. Part of traditional Chinese medicine is to look to see how well can this person handle the inflammation from the musculoskeletal injury. And so the TCM practitioner needs to be able to put their hat on that is musculoskeletal, figure out what that injury is, but at the same time, what can they treat? Liver, spleen, kidney, sanjiao. What can they be able to treat in order to be able to enhance the treatment? It's something that's a little scary to me. Is where musculoskeletal acupuncture is going in the U.S. and not looking at the internal.
Okay, so this actually does get back to my question, which is, how is the sports or orthopedic acupuncture different from like the TCM that we learn? And because a lot of people, we get the TCM training, and then often we don't get the results we're looking for. Maybe it's not the right stuff. Maybe we just don't know it well enough, which I think is often the case.
I agree.
Yeah,
I agree. It's a lifetime study.
What I hear you saying, even if we're dealing with something very, let's just say, meat suit level, there's a lot of other stuff going on, and we need to look at the deeper levels of the body. We need to know not only our anatomy and physiology, we need to know our Chinese medicine and put those both together.
Oh, absolutely. Because I can't tell you how many students that I have talked to that have come up and they've said that they're not either getting the results with the musculoskeletal treatment, or they actually hurt the patient because they needled too deeply or too aggressively, or they put the needles in and then they add electric stem without really examining the person's qi and blood levels first. Taking the tongue on the pulse and examining, like, who is this person with this injury?
Right. Yeah, you don't want to be doing too much stimulation on somebody with blood deficiency.
That's very true. And then some students will miss the target tissue. Some muscles or some points actually need to have a deep needle in order to create a certain effect, and some don't. And I think the beauty of traditional Chinese medicine with the tongue and the pulse diagnosis and the questioning and looking at the person's shen, their spirit, is imperative to be able to have a successful musculoskeletal treatment.
This is so delightful to hear you talking about this, because often I hear a kind of polarization going on. It's like, I do TCM, or I do internal medicine, or, oh no, I'm just working on.
That's exactly what I'm talking about, Michael.
Here. Yeah.
Is that it shouldn't be separated.
It's not separated. If we're really
it's
looking
not
at the tenets of Chinese medicine, right?
No.
Show me where the separation is.
There isn't.
There isn't.
I've done human cadaver dissection for over the last 30 years, a lot of them. And anybody who has done human cadaver dissection knows that every single cell is connected. Everything is connected along the interstitial fluids and the fascia, skin, all the way down to the toes. From kidney 1 to dew 20, it's all connected. So you just can't separate that. So it's important for those people that are just putting needles in people for lateral epicondylitis or knee pain. There's just so much more to that. And the reason why I know that is because I used to be one of those people.
Mm-hmm.
I used to be one of those people that I was getting such great results with needling motor points, which I researched about 30 years ago and published some work on it in the year 2000 and such, and found that it increases range of motion. And I just got very myopic and started needling motor points on people's pain. And then after a while, what would happen is that I was getting a lot of results, were great, but about 30% of the time, there was those cases that just did not respond to that. Mm-hmm. And I needed to look deeper. But I was so busy, and, I was in my 40s, and I was so cocky because things were going so well,
Right. And, when you're doing 70% pretty good.
It's pretty good. Yeah, but I wanted more. I wanted more. And so that's what really brought me back into understanding and studying the TCM and the Zongfu. And the way that life works, this is really funny, is that I ended up moving to New Zealand, and my entire practice, 98%, was menopausal women. And that really forced me to get back into the Zongfu.
How did that happen?
Because Kiwi men, they will not get any kind of treatment unless their arm's falling off. And if their arm is falling off, they're going to be holding it and laughing all the way in. But Kiwi women, they have, they take care of themselves, but the Kiwi men can't be bothered. Seriously. And that's a very serious story.
That's a profound change.
It was, but you know what?
It sounds like it woke you up in a way.
It's full circle. It's full circle. And that's where I can be able to sit here right now and comfortably be able to say that every musculoskeletal injury is going to have a Zongfu component. And if you don't treat that, you're not going to get long-lasting results with a majority of your cases.
Okay. So this raises a question in my mind. Are there certain injuries, certain knee injuries or elbow injuries, whatever, certain injuries that are sort of emblematic of a particular Zongfu issue?
That I can't go that superficial with it. I can't, if I'm understanding you correctly, Michael, is to be able to say that lateral epicondylitis will be associated with a certain type of Zongfu.
Right.
Right? Okay. Well, we could go ahead and say, because that's going to be large intestine channel, that if the large intestine organ itself is diseased or has pathology, then it's going to be reflected in the channel, which does happen. But I can't say that every case or a majority of cases of lateral epicondylitis is going to have a large intestine or even lung symptomology. It's
not that simple.
It's not that simple. I mean,
we really have to use all the tools we have available that we learned in school.
And more.
Really look at and more. What other tools would you suggest? When you say and more, what are you referring to here?
Well, continuing to study traditional Chinese medicine by researching the classics has a lot of information. By learning and studying with the scholars, the academics in traditional Chinese medicine that we have afforded to us today. I mean, we just lost a giant, unfortunately, with Giovanni. That was very sad. But there are some incredible speakers out there that share their experience. That are TCM and Zongfu oriented, and I think it's important to continue to study and research with these people. Now, when you can be able to apply that aspect then to what a lifetime study and art and skill of musculoskeletal treatments and assessment, then you've got a pretty good package with that. And personally, I feel like I'm still an infant with it, with how much there is to learn. There's just so much to learn. It's a lifetime of study.
It's totally endless.
It really is.
I mean, it really is. Yeah, the Chinese have one of these Chungyus, 4-character things that basically says the sea of knowledge is endless. There's no horizon. Actually, the sea of knowledge has no horizon.
Yeah.
Yeah.
Yeah. That's very good. I like that.
Hang on, I've got this question just sitting in the back of my mind.
It's percolating.
I so appreciate this conversation. This is a little unexpected. We all have our expectations. I'm coming to a sports acupuncture conference. I'm going to really listen to people talking about the meat suit. And here we are talking about, it's really important, and we've got all these other things that it's absolutely connected to. Oh, I know what the question is.
Here it comes.
So I'm thinking about athletes, and often when I think about athletes, I think about these sort of rarefied individuals. They're very focused. They train hard. They pay a lot of attention to their body and their motion and their sport and, whatever it is that they're doing. I'm wondering if you notice them healing differently.
Oh, absolutely.
Than the general public. And in what ways do you see them healing differently, and why?
Oh, much faster, much faster. Professional athletes heal very quickly because their qi and blood is really quite clean. And they are so in tune with their body that their proprioceptive systems are so in tune that the acupuncture needle can make wonders with that proprioceptive system very simply. It's less needles with professional athletes. Prognosis is usually cut by a third, if half, compared to the general public. Their diet is really clean, so it's really quite easy to be able to get results with professional athletes.
This episode is brought to you by Jane, the clinic management software that I use to keep my practice running smoothly. So, let's talk about something that can be a little bit uncomfortable, raising your fees. I know, this is something that might feel awkward, but it doesn't have to. With a bit of planning and care, you can handle it in a way that feels right for you and your patients. One tip, give yourself at least 2 months to prepare. This gives you time to get comfortable with the change and let your patients know what's happening. You can share the news through emails, booking reminders, or even just a friendly little sign in your clinic, and avoid over-apologizing. Instead, keep it straightforward and matter-of-fact. Keeping things consistent across the ways that you communicate can really help avoid confusion. Fee increases aren't always easy, but you're not on your own here. For more tips and ideas on how to communicate these changes with confidence, check out frontdesk.chain.app and look for the article, How to Tell Your Clients You're Raising Your Fees. Oh, and one last thing, if you're ready to give Jane a try, use the code CHIOLOGICAL for a 1-month grace period on your new Jane account. When you talk about their chi and blood being cleaner, and when I hear you say their proprioceptive sense is more enhanced, and of course that would make sense for any athlete, it makes me wonder if there's an element of their Shen that is also different. I'm thinking if you have really good proprioception, your self-awareness is probably a bit different than the average person walking down the street.
That's true. The Shen's always going to be looked at, right? So with professional athletes, their amount of focus and how they've trained themselves, that is part of the discipline that they have, right? So they've got a huge incentive to get better fast, because most professional athletes, depending on the sport, are making some pretty good income.
Right.
So
and they've got a limited shelf life.
That's correct. That's really correct. Yeah, so it's something they have a lot of incentive to get back onto the field.
Okay. You were mentioning that you've come full circle in the medicine. I love the story about going to New Zealand and treating mostly menopausal women. It's so funny how life will give us such surprises at times. I'm wondering what else you've changed your mind about in terms of acupuncture over the past 15 years.
Oh, that's interesting. I wish I had some more time to be able to think about that, because it's been a while. It's been a lot of years of practicing acupuncture, and I think there was a time where I was extremely myopic, and the way that I treated was the best way of treating musculoskeletal injuries. And the way that I was treating actually increased range of motion better than anything else. And that is just so far from the truth. And so, again, full circle, realizing that, that Japanese acupuncture is profound in what it can be able to do.
And so soft.
It's so, yeah, absolutely. So there's also even hands-on healing. There are so many different aspects of the acupuncture. Korean hand acupuncture works really well. The Japanese acupuncture works really well, and it's just for changing my mind. I think what it is just to be able to see that the way that I practice is the way that I understand, and so for me to be able to understand, then I can be able to apply that clearly to the patient. And the way that I'm doing it is not better than anybody else. It's just the way that I understand it.
The way I practice is the way I understand that. Thank you.
You're welcome. I'm
not completely sure what that means yet, but sometimes you hear something and it just kind of lands and you go, oh, this is something to unpack. And it won't get unpacked in a couple of days or a couple of weeks even.
I might have to hash that out a little bit.
Well, and let our experience hash it out.
True.
Right? The particular view we have of the world very much determines what we actually see in the world. And as our particular perspective changes, there's more that we can see. Hopefully more ways that we can help people as well.
That's the common goal. That is the common goal. And I think that's really what separates the successful practitioner to the people that are just getting by is really how much do you really want to help that person? Because if you really want to help that person, you get back into the books. You're researching, you're asking questions. Life is a mentor. You always have mentors. I mean, it's a great idea. Just keep asking questions. I've got this case, this, that, this, that. Have you ever had this before? Just keep asking questions. So I think all practitioners should never rest on their laurels, which we all do at certain points in their time. But it's, at least in my life, when I start resting on my laurels, life has a way of kicking me in the arse.
Oh my God. I don't know any of us, anyone that I've talked to that's been at this for any length of time. There is that developmental place we go through where it's like, you know what? I'm not too bad at this.
Right.
And it's like, I kind of have this dialed in.
Right.
That gets really dangerous.
As soon as you start thinking that you got it all figured out, life is going to kick you right in the kaboot. At least that's my experience.
It's totally been my experience too. People come in these days and they go, "Hey, Michael Max, thank you. You got rid of my back pain." And it's like, I need to be very careful with that.
Yeah, absolutely.
Because if I think I got rid of their back pain, it's not going to help either of us.
Yeah, we're just conduits. We study a lot, and in my mind, we are conduits to be able to help that person. And it's not really us. That might be getting out there for some people that's listening to this, but it's really not. It's not us.
It's not us, and yet there is an element of us that has to be fiercely present for it to be effective.
That's true. That's very true.
It's a bit of a contradiction.
Well, we are the applicators, but then who's when you're here's a good one. So when you're developing a treatment plan or protocol, and you have a new patient, you're trying to think, okay, do I have this diagnosis correct? What points should I go ahead and use? And you're thinking, and you're going back into the academics. Is that really all you? Is that really all your voices that are coming in? Or could there possibly be something else whispering in your ear? Some people are going, what is he talking about? Right? But hey, I believe in spiritual guides. I believe in angels. I believe in helping that person or whatever I need to be able to do or think or believe to be able to help that person. It gets me out of the way. I ask for help in the clinic room. Who's there to help? Is it just me? I don't think so.
You're not curious that we have to get out of the way to...
you got to get out of...
to find a way.
That's right. You got to get it. And listen. Yeah. What voices actually come in? What thoughts come in? Are those all your thoughts? I think it's kind of a little selfish to think that. That's madism.
Well, when you say listen, I think about the Chinese character for listen. And in the way that the traditional character is written, it's made up of several components. It's made up of an ear, it's made up of eyes, and it's made up of heart. And that's how you listen.
You know what? I think I would probably cheers these microphones with that's perfect, what you just said.
I mean, it's just one of those interesting things in the language that, and in the simplified characters, you don't see it. It's just a mouth to an ear, which is often the way we think listening is, but it actually includes what you were just talking about.
Yeah, the heart pericardium.
The heart pericardium, that communication piece, so important. Yeah. So you've been at this 30 some odd years.
Well, no, I've been licensed for 26.
Okay.
But as far as like putting it all together, it's been 30 some years.
It's been 30 some odd. You've been at it a while. One of the things that people often go to conferences for is because they want to learn to get better at what they're doing. They want to have a successful practice. And in fact, there's actually by the time this airs, we will have had a roundtable discussion on getting a sports acupuncture practice up and going. And I think it's really important to focus on the things that need to be focused on to get your practice successful. So you can do your work, you can do your art. But the thing that gets you started and successful in your first, let's say, 5 to 10 years is not what's going to keep you going at the 25 or 30 year mark. there's something else that happens. And I think I heard you mentioning this, that you had a certain way that you were working. You land in New Zealand, life reconfigures itself. We're sitting here in San Jose right now, California, having this conversation, and you're talking about the importance of reading the classics and going back to, knowing your fundamentals, knowing your Chinese medicine, in addition to your orthopedics. So this isn't a question about technique. This is a question about development as a practitioner. What is it that, after 25 years of doing this, is the thing that keeps you going and the next thing to work on?
It's passion. It's passion. It's the pure joy of developing techniques from ideas that usually when you get ideas, it's coming from somebody else's ideas, and then you take that idea and then you be able to evolve that idea, and then you start putting it into some kind of practical manner, and then all of a sudden that practical technique starts to work. That's really exciting to me, developing different needle techniques or different treatment protocols that can be used. So I think having the passion to develop different things and then apply it to the public, and then it works, and then the patient is out of pain and they're able to get back to their activities of daily living, and they look you in the eye and they say thank you. That to me is better than payment. And then you get paid. Mm-hmm. We got to get paid, right? We have to get paid.
Otherwise we don't get to do the work.
But to get results and to apply the results, to assess a condition and then apply the treatment plan and protocol and then see the results is really something that's fantastic. Now, there is a common thread between day one of getting your license and seeing your very first patient to 30 years later. And in my mind, that is managing your patient's health care. That's not taught in acupuncture schools. And there are some practitioners that are brilliant at it, and there's some practitioners that really need some help with it.
So when you say managing your patient's health care,
making the patient accountable for taking their herbs, making the patient accountable for doing their particular exercise, giving them homework to do, having them bring a dietary log in that they're doing. You're managing their health care instead of just applying a treatment, then I'll see you next week. Mm-hmm. No, it's like, based on your experience, how many treatments is it going to take to be able to have this case of lateral epicondylitis come in? So do I want to treat this person twice a week for 2 weeks and then I expect 60% improvement? I mean, having some kind of prognosis, I think, is going to be very important, and that's part of managing the person's health care. That leads to success.
Yeah. So what I hear you saying is taking a very active role, not just you're here for your treatment, I'm going to do your treatment, whatever you do with your life, good luck.
You're getting involved in it.
Get real involved in it. So what do you do with the patients that don't take their herbs or
don't do their exercises?
Don't do their exercises or eat the things they know that are going to cause them troubles.
Well,
I've seen plenty of patients who they know if they eat glutinous types of things, and because they have a sensitivity, their joints are going to be really, really painful, and yet they make those choices.
Sure. So usually with those kind of cases, if they're getting results, there's not much I can really be able to say. Like if they come in and they have a certain pain that's on a scale of 1 to 10 and it's a 10, and you treat them twice and now they're down to a 1, but they're still eating the wheat gluten, there's not really a whole lot that you can be able to say other than that's really not that good for you. Right? But if that person's coming in and they have a pain, a scale of 10, you treat them a couple of times and then it's at an 8, well, I mean, that's where you just have to kind of hit them in the wallet and just say, how many times do you want to come back and see me and pay me this money when you're handicapping me? I'm treating you basically with one hand tied behind my back. How much do you want to get out of pain? And that's where you start getting into the person's spirit. That's where you start questioning them. Like, do you need this pain?
Mm-hmm.
Why?
Well, now I had never thought about it from that point of view. What is this pain doing for you?
Yeah, ask a patient though. It has to be appropriate.
Well, yeah,
it has to be appropriate. But I mean, that's some people really have to think about that one.
That there might be a function for the dysfunction, and you need to uncover that as well. Yeah.
They have pain somewhere else in their life. And so that musculoskeletal injury is really bugging them the more and more that they're having that other pain in their life. Let's say my partner's a pain in the ass. Well, they come in with a gluteal strain. My boss is a pain in the neck. They come in with a neck problem. They're shouldering the world, right? They don't have a foot to stand on. I mean, all of those. I mean, if you read Louise Hay, right? God bless her soul. If you read Louise Hay, she was really onto it. You know, there's a lot of things that she said that she noticed from her own practice that I think are really actually very true.
Imagine this. A patient walks into your clinic. They're carrying more than the pain in their body. There's a story there. A history woven with the stress of long days, the ache of things unsaid, and the quiet longing for something to shift. You listen, not just with your ears, but with your hands, your intuition, your heart. It's not just about needles or a formula. It's about connection. Understanding the threads that tie us together, mind, body, and spirit. That is where golden flower Chinese herbs comes in. Rooted in tradition and crafted with care, their formulas are more than herbs. They're a bridge between ancient wisdom and modern practice. Every bottle, a quiet partner in your work, helping you to meet your patients where they are. Because healing isn't just about treating symptoms. It's about creating trust, cultivating belonging, and helping someone feel truly seen. Golden Flower Chinese Herbs, your partner in practice and connection, where tradition meets care. So sometimes and I've seen this in many cases, the symptom is not the enemy. It's often a messenger, and it's a really loyal messenger because it's going to stick around until it gets listened to.
Right. Yeah. I mean, we can treat the signs and the symptoms, or do we treat what caused the signs and the symptoms? Mm-hmm. And that's the goal, isn't it? It's to treat the cause.
Yeah.
What's next, Michael? Let's go.
This is great, man. This often happens when I'm doing one of these interviews. There'll be a moment where there's a kind of a pause because it's like,
let's take that one in.
It takes a little time to take some things
Mm-hmm.
in. Yeah. Can we go a little further down this rabbit hole?
Sure.
All right. One of the conversations I hear within our community, there's people that are like, yeah, I just want to help people feel better and make their pain go away. And there's other people that say things like, well, actually, I don't care about their pain. I just want to, treat their spirit. Right.
Mm-hmm.
And those are actually two sides of a continuum.
Mm-hmm.
Right.
Mm-hmm.
Increasingly, in my practice, I'm curious about this spirit aspect. And what do I mean by it? And even saying things like spirit aspect, it starts getting kind of woogity here. It's like, what exactly are we talking about? So when you hear things like spirit aspect, or you say things like spirit aspect, what are we talking about?
It's your soul. It's the sparkle in your eye. It's your character. It's who you are on a cellular level. What drives you? What makes you sad? What makes you happy? It's your soul. So it makes your heart beat. So who is this person that's coming in with this musculoskeletal injury? It's a really great combination is when I have people coming into my educational program that are Worsley trained 5 elemental acupuncturists, which is all based on treating the spirit, right? And energetic blocks, freeing up the energetic blocks, which can be accomplished in a number of different ways, not just 5 elemental, but 5 elemental is good. It's good. Is using 5 elemental acupuncture with also orthopedic type of acupuncture. That combination is pretty magical because you can change somebody's, we just keep sticking with lateral epicondylitis because it's there. We've already been talking about it. You can change somebody's lateral epicondylitis pain drastically if it's coming from a block, an emotional block. And so if they're going to go and see someone who's not looking at the Shen or treating the Shen, 5 elementally, Japanese acupuncture, TCM, it doesn't really matter, is that they're not going to get the results until that person is actually able to move through that block energetically, move through life gracefully.
Given that the spirit and the body, of course, intimately connected, I mean, even the idea of saying there's a mind-body connection predisposes a disconnection, right? I mean, and I think this is hard for us as Westerners who've grown up with these distinctions, that there's a separation between mind and body. One of the beauties of Chinese medicine is there's not that separation. But it seems like it takes a long time to be able to actually feel into what that is, to be able to feel into that unity, to be able to feel into, oh, there's this hole here, and I can work on any aspect and connect with every other aspect. I think it takes a while to actually grasp that as a practitioner. It's so much easier to go, I'm working on the elbow, or I'm working on the issues with the marriage, whatever. How do you know when to work at which level?
I don't. You can't separate it. There's obviously going to be priority, right? So, I mean, I'm just throwing a dart with blindfolded. I just try to treat it all. I have little mottos like fix what you find.
Fix what you find.
And so if you find that this person is, like, for example, an initial office visit where their words that come out of their mouth describing the musculoskeletal injury does not match the Shen expression in their face or their eyes. That to me is a telltale sign to be able to start getting that connected, because they're disconnected in spirit with that. And so that particular case, the treatment would be, I'm just hypothetically speaking here, 40% musculoskeletal, because they're coming in to my practice for musculoskeletal injury. But then 60% is treating that Shen and trying to be able to get that person connected.
Because you notice that they're not connected.
You notice it's not connected. And sometimes I wonder too, is that, you apply your acupuncture protocol and your moxibustion protocol and your Chinese medicine as much as possible. But sometimes I wonder if it's just the words that you say at the right time is what actually causes the healing for that particular case.
So you've noticed this in your clinic too?
Absolutely.
Something in the room actually changes, doesn't it?
The chi in the room changes.
The chi in the room changes.
Yeah, their Shen as they're laying on the table changes. And you can see that. Most people, I think us energetic workers with acupuncture can really see it and feel it. A practice that I've done in the past and I coach my students with is that look at a candle when it's dark and look at the flames above it, and how far can you be able to take those heat flames? How far can you see the vapors? And so when it gets really quite dark, but you still see little waves of the vapors, apply that to the human body. And when the person is laying down and you're putting acupuncture points in, step back and take a look and see if you can be able to see those energetic waves. A lot of times it directs you that, oh, I need to be able to put a point here. Oh, wait, I can see that. I need to be able to put a point here to be able to change the chi of that patient.
I love when interviews go in way unexpected directions. Not that I know what to expect.
Here comes Matt, meat suit Matt.
When would you say these sorts of changes started happening for you?
What changes?
It changes from working, like Mr. I'm going to needle these motor points and help people's range of motion, to I'm noticing a person's not connected emotionally to the physical pain that they have.
Well, I think I've always seen that aspect of it, where there's a little bit of a disconnect between the words the person is saying and their expressions that they have, or even the look in their eyes. You can see how one eye is going to have bright Shen and the other eye is dulled. Right, so it's that type of person. When you look at him, like for example, if you had a 3x5 card and you cover up one side of the face and you see expression, and the other side of the face and it looks really quite dulled, that there's just too much going on in life for that person right now, so they can't take in anything, but they're still able to give. That is something I think is really important to be able to treat. Now, as far as when I started that, I think it's always been day one. I've always been a bit of an odd person, I've been told. I'm definitely not your norm. But I did go through that period of meat suit acupuncture when I was developing a lot of the motor point aspect. Because motor points were not discussed at all when I started. It was trigger points. Mm-hmm. So actually putting a stainless steel needle into the motor nerve innervation, when I first started doing it, it was met with a lot of skepticism. And then there was also met with, wow, this is great because we are changing people's chi and getting them out of pain and changing range of motion. So, once I started getting popular with that, then I became very arrogant, egocentric, myopic, and had 5 rooms going at the same time, 4 assistants, and I was basically just doing meat suit acupuncture. And I started getting away from TCM. But what really bugged me is, like what we said earlier in this conversation, is that there was quite a few people that just were not responding. So with age and experiences, there's a seasoning that takes place, mm-hmm. And a desire to be able to help even those really difficult cases. And so, the rest we've already talked about.
Yeah. Well, I've noticed it's kind of a curiosity. And this isn't acupuncture. This is just living enough years to notice that often things that are solutions at one point and really helpful become stumbling blocks and things to move beyond at another point. And I find that process is relentlessly unending.
Yeah, I agree. And the more that you have the chi and the passion to continue with it, the better off it is. And my biggest lesson, I think, during that time is to become humble, because it's not all about me. And the more that I made it that way, the more then it was lessons in life that just kicked me in the ass.
What really has your attention and interest right now in terms of what draws you in your practice and the things that you're working on and what seems new and interesting and seems to be coming up for you in the work that you're doing?
Yeah, well, currently right now, what we're developing in the SMAC program is myself and also Brian Lau. Brian Lau is a co-teacher with me in the program, and looking at, which a lot of people are looking at now, it's become much more popular within the last 15 years, is fascia. Looking at the fascial and the myofascial planes as actually being part of the answer of what the channel systems are and how the myofascial planes have communication from cell to cell to cell. So taking that model and applying acupuncture points to local, distal, and adjacent, and changing or actually using that as part of the assessment. Like, for example, let's say that somebody has a supraspinatus injury that you're suspecting is a supraspinatus injury, and you do Hawkins-Kennedy test or you do painful arc test, is to look at what sinew channels are affected, what channel correspondences are affected as part of the assessment. We still have our assessment hat on, and plug in 1 or 2 needles as the person is standing there. Then repeat the painful arc test, repeat the Hawkins-Kennedy test to see if it's reduced by sometime 80%. And that gives you an idea of, okay, what channels are going to be affected. Mm-hmm. That's part of the assessment. So then looking at then what's going to be the best way of actually treating this particular condition and managing the person's health care from initial office visit all the way back to the tennis court. That just doesn't get boring. I mean, it just doesn't get boring to be able to have this person go back and to their activity of daily living or their sport that drives their spirit, that gives them passion, is really a high for me.
I think that's probably going to do it.
That's a lot of information.
It's a lot of information. Thank you so much for taking the time here today.
You're welcome.
We'll go get back to the conference.
Thanks for having me. I really appreciate it.
All right, friends. That's it for this mini-series from the Sports Acupuncture Alliance. Again, a deep bow of appreciation to both the Sports Acupuncture Alliance and ALASA OMS for their dedication to our profession and the support they provided in bringing you this series. Well, here we are at the end of this episode. If you've listened up to this point, you're either a rabid fan of Qiological or the forward button on your podcast player stopped working. If you are indeed a fan of the podcast, you can help us to bring new episodes to our community of practitioners by supporting us with a membership or a one-time contribution. Details, of course, are on the website. That's it for today, friends. Join us again next Tuesday for another thoughtful episode of Qiological.